All right, so meningoencephalitis, inflammation of the brain and meninges. Suppurative inflammation, very similar to other organs. Go back to your GenPath principles when in doubt. Usually associated with bacterial infections. So see pus, think bacteria. Meningitis, suppurative meningitis specifically, is often associated with sepsis. So this is a lesion we see most commonly in young animals. They're technically immunodeficient. Their immune systems are still being built and developing competence. They've got waning maternal immunity, or maybe a failure of passive transfer where they didn't get maternal immunity. So we most commonly see this in neonates. Look for concurrent lesions of sepsis. So polyarthritis is another big lesion in septic animals, often suppurative again. Look for a septic focus. So like, is there an abscess somewhere, an umbilical abscess? Check the tail dock site, castration sites, all the common portal of entries for sepsis in neonates. And those concurrent lesions will give you clues as to the etiology of this. In young adults, histophilus is a pretty important cause of meningoencephalitis, specifically in that age of feedlot cattle. So this goes along with bovine respiratory disease complex, or shipping fever. This is a shipping fever bug. TME is thrombotic meningoencephalitis. So this is a bacterial infection in the lung. The animal becomes septic. This organism specifically has a tropism for vessels, and it gets in there, causes all these septic emboli. So all these little red dots in here are all little essentially microabscesses. They're places where bacteria have embolized to the brain, and each one of those little foci is going to be a little suppurative area. Here you can see severe clouding and thickening of the meninges. I can barely see the gyri and sulci under here. This is so thick. So this is all neutrophils and fibrin. In adult animals, we can still see it with sepsis. However, we tend to think of also these couple specific organisms that can result in sepsis, potentially in an immunocompetent animal. And that's primarily erysipelathrix and brucella. Just a fun fact, we see a lot of brucella meningitis in dolphins that come in from this area. Not sure where they're getting that, but it's in their brains and it's killed a handful of them. So big issue with meningitis specifically is the meninges don't offer a great defense for inflammation. They're more of a physical barrier. They don't offer very much resistance to the spread of infection once that gets established in there. Because this is bacterial, often associated with sepsis, this is a very severe lesion. It's almost always acute or subacute because animals don't survive this. This is severe. For the pathology, again, look at this guy, very thickened, opaque meninges. I can't see the brain through them. There's clearly some cloudy pus-like goop in here. This can be a subtle lesion. It's not always this severe. So in more subtle cases, you'll just see, I wish they hadn't put that there. You can kind of see it here, but check the actual sulci for like little rivers of pus, just kind of like flowing through there. So that's like the early lesion. Check the base of the brain, because that's where gravity is going to drain all the pus. So you'll be more likely to see visible signs if you're looking at the bottom of the brain. And then again, don't forget the animal has a body, not just a brain. Look at the rest of the body for concurrent lesions that kind of go along with this presentation. All right, so here are some more subtle examples. Here's one where you can see pus is accumulating just in the sulci. I can still see the tissue of the brain, the gyri, but you see how there's all this white goo in between that ought not to be. Disgusting. So this is even this I would call pretty severe diffuse suppurative meningitis. Here again is another case, pretty subtle up here. If you look at the gyri, maybe there's some stuff in there, but if you come back here, here's a big pus fibrin blob right there. There's maybe another one right there. So it can be quite subtle, grossly, even when it's pretty severe. Here's what that looks like microscopically. Here's the meningeal surface. This is a big blood vessel that's dilated right here. And here is neuropil, this pink stuff. So this is the brain, and the meninges are no longer defined, and I can't even see a distinction between the meninges and the brain. It's just becoming contiguous. So this kind of illustrates that principle of how meningitis becomes an encephalitis and how often it's a meningoencephalitis when there is severe meningitis of any duration, because it just goes into the brain. Brain is soft. Everybody poked it. Not very much resistance to spread of anything in there. Once stuff gets in there, you are hosed. All right, another example of suppurative encephalitis. So it doesn't have to be meningitis. Remember, those embolic lesions can go anywhere that there's blood flow, and if there's inflammation, the blood vessels will open up and the pathogens can get in. So abscesses in the brain, had a couple of those in lab yesterday. These will be big pus pockets, and they're surrounded by somewhat of a capsule. It's a little different in the brain because remember, there's no fibroblasts in there. So this will be those hypertrophied astrocytes forming that glial scar around the cavity, but it'll look very similar to an abscess. It's a hole with a slightly defined rim around it, and that indicates chronicity. So this is a chronic suppurative lesion. This is strangles, bastard strangles in a horse. It's strangles if it's where it's supposed to be. It's bastard strangles if it's anywhere else. So if it's forming abscesses in your tissues, it's bastard strangles. I just like saying bastard. Sorry, I'll stop now. Okay, Listeria. So this guy is cool, one of my favorites. He has kind of a special mode of transport. So this is one that also invades axons, but it does it by essentially co-opting host actin. So you guys remember what actin is, like myosin and actin. It's a muscle protein. So this is part of the cell cytoskeleton, and it's how the cell moves things around. So they essentially, polymerize actin to crawl along these microtubules. It's like pulling yourself up a rope, and that's how they get across the cell and deliver their cargo and stuff. So Listeria has actually developed receptors that interact with our host actin in our cells, and it uses that to not only crawl around the I see mouths dropping open, like, what? It's horrific. To crawl around the cell, but also it's like, hey, I need you to throw me to that other cell over there. Just pass me across. So it does that in your neurons. It's just like, I'm going, we're actinin all the way up. So it's kind of like retrograde axonal transport, but the bug is like doing it itself by like, it just like latches onto a microtubule and it's like, here we go up to the cell body, exploring. Isn't that cool? Yeah, so cool. Creepy, but cool. So because of this mechanism, this is an intracellular pathogen, primarily infects monocytes, macrophages. It's in the name, Listeria, monocyte, monocytogenes, likes monocytes, macrophages. This is a pretty ubiquitous pathogen. It's in the environment. It survives refrigeration, so that's really important for human infections. Humans get this as a foodborne illness, and this is why pregnant women should not eat soft cheese, because it can survive refrigeration in... What? Don't believe me? Fine, get pregnant, eat soft cheese, I don't care. Don't, though. Dr. Eames and OSU do not condone eating soft cheese while pregnant. Foodborne illness. There was a big outbreak with cantaloupe a couple years ago. Does everybody remember that? Killed a bunch of old people. That was Listeria. So this is a human pathogen. This is potentially zoonotic. Natural disease is most important in ruminants. We see it a lot in goats. Deli meats, yeah. Don't eat anything refrigerated while you're pregnant. No. Cantaloupe, yeah, cantaloupe, soft cheese, deli meats. So disease is most important in ruminants. We see kind of sporadic outbreaks of the disease. It's usually during winter and spring, because that's when silage tends to go bad, and this is associated with heavy silage feeding. So syndromes, there's kind of a couple, and these are usually not seen together. They may be seen in a herd, but you will probably not see them together in the same animal. So there's late gestation abortion, syndrome of septicemia, and visceral abscesses. Again, these septic syndromes are going to be primarily young animals, and then adults present primarily with encephalitis. So here's what that looks like. Clinically, this is called circling disease because of the way animals often present. It's usually lateralizing, so animals will have either a head turn or a tilt, and then they will circle very commonly in that direction. They can be confused, depressed, so there's kind of a mix of cortical and brainstem signs. If you get the brainstem involved on one side, you can get unilateral Horner's. So that's from paralysis of cranial nerve 7. And then this can also, because of that actin polymerization and crawling through the nerves, this can actually reach the eye, and you'll get a suppurative endophthalmitis. Everybody remember what that means? Endo, inside, opthal, eye. Yes. Just get to the point, Dr. Eames. We know the words. Okay, so a major differential for suppurative endophthalmitis in a ruminant is going to be malignant catarrhal fever. Keep that in mind. This disease usually presents pretty acutely, so hours to days, and without treatment, they will die pretty rapidly. Primarily brainstem signs, but often have some cortical as well, depending on where this thing goes. In the pathology of this, it has a high affinity for the brainstem, and we call these suppurative microabscesses, which I don't really understand why we call it that, because it's a little pocket of neutrophils. It's not an abscess because it doesn't have a capsule and it's microscopic, right? So, but we call them suppurative microabscesses. So it's just these little foci of neutrophils in here. Here's a little guy. Here's a dying neuron. We call these the dead reds. He's angular and shrunken. Here again, there's a little pocket of neutrophils that you can see more close up. And here is a neuron actually being invaded and eaten by neutrophils. That's called neuronophagia. Here's what that looks like grossly. This is pretty subtle. I would not expect you guys to pick this out, but there's just a couple foci of discoloration and softening in the brainstem. And then here's a gram stain, and you can actually see these teeny tiny little gram-positive intracytoplasmic rods. This is a really good case report if you guys want to some more practice. It's like one of the diagnostic challenge exercises. All right, so that's suppurative. Granulomatous and Pyogranulomatous, again, go back to GenPath. Primary causes of granulomatous inflammation are going to be fungi, especially the dimorphic systemic fungi, so blasto, crypto, histo. Higher bacteria, we call them higher because their cell walls are more complex. They have unusual lipid components, making them difficult to digest. So remember, that's kind of the underlying thing with granulomatous inflammation, is it's something that the body is having a hard time getting rid of. So something indigestible or difficult or hidden about that bug. So special bacteria, definitely fungus. FIP, vasculitis, is another one. This is Pyogranulomatous inflammation targeting the vessels, and you can get extension of inflammation into the brain, especially in the ventricles. Parasitic and algal, so Prototheca is a algae that can cause systemic infections that go to the brain. And then there's several sterile or immune-mediated syndromes, especially in dogs, primarily in small dogs. There's a pug meningoencephalitis, there's a Yorkie one, there's a bunch of different breed-specific syndromes of immune-mediated, and many of those are granulomatous or Pyogranulomatous. So appearance, granulomatous inflammation here is going to look pretty much like anywhere else. It's going to be firm, so not usually spreadable with a butter knife. It's going to present as nodular thickenings of the meninges, so actual granulomas. And then large lesions, of course, just like a tumor, can cause a mass effect and compression of the tissue. So this is a case of aspergillosis in a canine. This was a German Shepherd. Here is the spinal cord right here. You can see how it's compressed and misshapen. We probably have a little bit of stenosis of this central canal right here that looks pretty small there. It's almost disappeared. And you can see it's primarily affecting the meninges, but look at this segment of the cord. It's crawling in there. So here there's a nice demarcation. It looks like it's compressing. Here, I can't really see that margin anymore. I think we've got granulomatous inflammation actually extending into the cord. Here, we have overt malacia of the cord. This is now brown and soft. So here's the granuloma out here. Here's the nodule of inflammation. But all this ventral area of the cord is brown, discolored, soft, dark, compared to this normal cord, which is kind of this nice bright white. Here it's nice, here it's blue. So this would be a granulomatous meningomyelitis with malacia. Potentially, there's also a unusual syndrome in German Shepherds infected with a specific strain of Aspergillus. It's called Aspergillus terris or terius. And aspergillus itself is actually angioinvasive. So it has a predilection for invading blood vessels and causing vasculitis and going systemic. And there's something about German Shepherd dogs that is immuno-weird in just the right way to be more susceptible to that specific aspergillus. So they often present with like fungal sepsis, basically, like everywhere. So this could potentially be from the nose or the brain. Maybe more likely in a German Shepherd to be this one of these systemic weirdo things. Super uncommon, but cool. Other questions about suppurative or granulomatous? Meningoencephalitis. Cool. Here's what it looks like. Looks granulomatous, just like in other places. This is a dog with blastomycosis. So you see all these little nodular, kind of irregular thickenings down here. That's a nerve. Ignore that. But this is just kind of the meningeal surface is just kind of rough and bumpy. Here's a much clearer example. So this is a horse with cryptococcus. The dura has been removed and reflected. So here's dura here. We're looking just at the cord. So this is, what would you call this? Not this, right? I mean, maybe. If that's dura and here's leptopia. But what is it more likely? I think I heard it. Myelitis, yeah. So meningomyelitis, granulomatous. So all this lumpy, nasty, rough, firm. Lots of neovascularization up here too, all these little blood vessels. And then here's a case of tuberculosis. I'm not sure what species this is, but dura is still on, and you have to kind of peek under it and infer that there's a lot of badness under there. So all these little granulomas are actually in the spinal cord itself, intradural.